Stena, a member of Superlife. I am a HIV/AIDS consultant and a medical microbiologist. And Superlife Nigeria is bringing this to us, and we are all grateful to this wonderful company. Now, infertility is a challenge that affects 1 out of every 6 couples. 1 out of every 6 couples globally. So if you pass or you are in a gathering where there are 6 couples, going by WHO estimate, 1 out of those number of couples will be battling with infertility. Then another disturbing statistics that we have is that among those who are suffering from infertility, among couples that are suffering from infertility, 1 out of that number, both husband and wife have the problem. So let me reiterate this fact. Going by WHO estimates, out of every 6 couples you see, 1 of those couples have infertility. Either it is from the man or from the woman. Now, out of the number of families or couples that have infertility as a challenge, 1 out of 5, both the husband and the woman have the problem. So you can see it is a major problem. So globally, going by WHO 2022 estimates, we are looking at between 48 million to 186 million individuals globally that are having the problem of infertility. So you can see how large the numbers are. So you can estimate the families that are going through social, psychological challenges. Now, if we come down to Nigeria here, the same challenge is seen. So it is not just a problem that is seen outside. We as Nigerians are equally battling with this problem. Now, there will be need for us in this lecture to zoom in into infertility to understand what it really is. So today we will be looking at the different kinds of infertility, Each time we mention infertility, there will be need for us to understand that there are 2 kinds that we can look at. The first one is primary infertility, and the second one is secondary infertility. But before we go into these 2, what is the definition of infertility? I'm sure a lot of you folks will be wondering, how do we define infertility? Infertility can be defined as a disease of the reproductive system, and we define it as the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. So when couples are having unprotected sexual intercourse and it runs into 1 full year or more, and they are not achieving what we refer to as clinical pregnancy, then something is wrong somewhere. And that is when you begin to see a lot of Africans, especially if you have these father-in-laws and mother-in-laws, especially the mother-in-laws who are expecting grandchildren, beginning to trouble the couples. And you see these couples worried. So just like I said earlier, we have 2 kinds, primary and secondary infertility. What do we mean by primary infertility? Primary infertility means that the couple in question has never conceived at all. That means they've been together and there have been no sign at all that the lady can take it. So when we see situations like this after 1 year, then there's every possibility that the doctors will begin to query or suspect primary infertility. No sign, no history. The lady has never had any history. Some, especially for those who probably have exposed themselves to sexual intercourse and before they even got married, and no history at all. She has never had a conception. The man too, no lady has ever said she took him for him. So in this case, the doctors will be suspecting primary infertility. Now, what is secondary infertility? Secondary infertility means that the couple has experienced the pregnancy before and have failed to conceive later. So that means they've had history of conception. So we see cases like this a lot where after marriage they have a first child, and after that they are having difficulty in having another child. So when we see cases like this, we're looking at secondary infertility. Globally, if we look at the statistics for infertility, we tend to have more of primary infertility. But if we zoom into sub-Saharan Africa, we tend to see more of secondary infertility. So by and large, the two play a major role in the world estimates that we see. Now, there is need for us to understand what could be responsible for infertility, both in females and male. Now, let's look at the female. Some of the predisposing causes of infertility could be one, endometriosis, what the medical practitioner refer to as endometriosis. Endometriosis is a painful condition in which cells from the uterine lining implant themselves outside of the uterus. And when they do this, you find when the lady menstruates, she bleeds a lot, and the bleeding can be very painful, abdominal pains. So please, I want to reiterate this fact. Cells that are meant to be beneath the endometrium are now appearing on the surface. So if you look at the pictorial slide that you're seeing before you, you are going to see to your right how endometriosis takes place. You can see the normal uterus, how neat it looks. But in the case of the second one to your right, you can see how the cells have implanted themselves on the surface. This does not look good, and women that go through this, it can be one of the various reasons why they are having the challenge of infertility. And if this endometriosis is not properly handled, we may even see a situation where it can lead to the formation of ovarian cysts. Yes, so please, this can be one of the major causes. Another one could be, just like I emphasized in the first one I mentioned, the development of ovarian cysts. Ovarian cysts are common growths that develop on or inside the lady's ovaries. And please, it brings about, once it is there, it causes menstrual irregularities and pains when the woman is having sex with her husband, and sometimes the woman sees irregular bowel movement. Now, all of this can predispose the woman to not having proper conception. So ovarian cyst is another one, because the reason being that there's menstrual irregularities. And for a woman who wants to take in, we don't want to see irregularities in her menstruation period. Another one is what we refer to as cervical stenosis. Cervical stenosis are abnormalities of the mucous-sperm interaction. Now, if you look at the uterus, the section of the cervix, in a normal, healthy uterus, the cervix opens very well. But in women with cervical stenosis, you find out that the cervix constricts, making the tube or the passage very narrow. And once we have a narrow passage within the cervix, of course, you begin to find seminal reflux, where the woman, after having sexual intercourse with the husband, you find the sperm coming back. Why? Because the passage within the cervix has been narrowed to such a dangerous position that the woman may not be able to take it, because fertilization may not occur, because the egg cell should be coming from the fallopian tube down, and the sperm cell is meant to pass through the same cervix into the uterus, where it meets with the egg cell as it comes through the fallopian tube for fertilization to be achieved. So once this is prevented, we find the woman having this challenge. Then we equally have another challenge with congenital defects of the uterus. When women undergo this problem, it's a major challenge, and it is a challenge that needs to be handled medically. Because if you look at the diagram before us, a normal cervix, you can see how it looks to your left, but when it becomes defective, there are 5 major defects that have been identified, even though we see more now from research, but there are 5 major defects we have been able to observe in the medical world. The first one there is what we call the DD fields. The DDL fields. You can see how rather than having a uterus that is single, in this condition, you find the walls of the uterus pressing down, dividing the uterus into 2 major halves. And once we have this kind of challenge, you can see that the sperms that will even be coming from the male to the woman will not even have a place to pass. Why? Because it has been completely blocked. Why? Because there's this invagination that has gone down to where the cervix is and blocking the passage of sperm. So with this kind of defect, it's really going to be a problem for a woman to take it. Another type of defect that we see in the uterus is the one we refer to as arcuate defect of the uterus. In this other one, the invagination comes down a bit through into the uterus, but in such a manner that it closes to a larger extent the site to the fallopian tube. And with this kind of protrusion down deep into the uterus, you find the woman having a challenge. Even though she may, in some cases, become pregnant, you find her losing the baby through miscarriage. Then another terrible defect that we see amongst women is what we call the uniconnuate uterus defect. Uniconnuate. This one is so bad that it completely blocks a section of the fallopian tube, leaving only one section available. Even at that, it closes it. So there's no way a baby can sit in this kind of uterus. The fourth one there is the biconnuate. This one too is as bad as the DDL fits. In this case, there is this protrusion that is deep down, and even though the sperm may likely get to the fallopian tube, yet again, there's no place the baby can sit in this particular kind of womb. And once there's no place for a baby to sit, then there's no way a pregnancy can be achieved. The last one there is the septate deformity, congenital defect. This one, the sperm is even prevented in the first place from even gaining entry into the uterus. Why? Because the walls of the uterus have protruded down, blocking even the cervical, the cervix for sperm to gain entry into the uterus. So with this kind of conditions that women go through, especially those with infertility, there will be strong need for our medical personnel to establish which type the woman is really undergoing in order to have a proper diagnosis of the condition before the right mode of solution can be advised. Now, another one again is what we call ovarian alteration. Ovarian alteration can, if a woman is going through this, it can equally create a problem where she finds it extremely difficult to get pregnant. That is failure to ovulate. When a woman cannot ovulate, then how can she be able to achieve pregnancy? And we see this in ovarian alteration. And most people with ovarian alteration, they have what is called polycystic ovary. If you look at the diagram, you see the normal ovary to your left, and you see a polycystic ovary. So a patient with polycystic ovary has difficulty with ovulation. And even when they do ovulate, you find out that there's the menstrual cycle is really not steady. You'll find more than one menstrual cycle at so many times of the month. So this is equally a major challenge. And one thing we have observed as part of the predisposing cause to this is the use of wrong medications. And sometimes most women who are suffering from this kind of infertility have a challenge with emotional imbalance. Why? Because they waited for a year, some more than 1 year, some into 2 years. You find them having emotional imbalance. And once there's emotional imbalance, you'll find there's this challenge of the polycystic ovary developing. Another problem again that we have observed is the issue of tubal abnormalities. Tubal abnormalities. Now, tubal abnormality is a major challenge too, where the fallopian tubes are blocked. If you look at the diagram before you, you are going to see blocked fallopian tubes. And some of these are either congenital or acquired. And once we see this, some women may have predisposed themselves to sexually transmitted diseases such as gonorrhea, syphilis, and so many other diseases. So once this happens, there will be no room for the egg cell of the woman to pass through. Why? Because the fallopian tubes are blocked. So this is another good example where it can make a woman not to conceive. Another problem again that we have seen with women not conceiving is the issue of uterine tumors. Yes, fibroids. Yes, fibroids. Fibroids may prevent conception, and some fibroids even grow deep inside the uterus, so is that even when the woman becomes pregnant, there's this battle. Though we have seen women with fibroids who conceive, but we have equally seen women who have fibroids and finding it difficult to conceive. So in either case, fibroids play a major role in preventing conception, even though we have seen women with fibroids that have conceived. So it is still a factor. Then another thing that we need to talk about is the issue of contraception and abortion. There are some women that have been on some contraceptive pills in order to, for reasons best known to them, they don't want to take in. And when they now want to take in, there's a challenge. They can no longer become pregnant. We've seen this a lot with a lot of our women folks. While in some other cases, the lady may have done abortion in the past, and because of that, she's finding it extremely difficult to take in. So for the males, there are so many factors that can be responsible for male infertility. We have what we refer to as pre-testicular causes, testicular causes, post-testicular causes, and sperm-related causes. In the case of pre-testicular causes, this particular one, there are no signals coming in from the brain, so the man is finding it even very difficult to bring about an erection. Are you getting it? Because the message coming from the brain is not coordinated. So you find erectile dysfunction, the person not being able to achieve an erection. Sometimes we see coital disorders, and in some cases, we see what we refer to as retrograde ejaculation. So as a result of no proper signal from the brain to the erectile organ. While in the case of testicular causes, you find the testes having a challenge. So we've seen this with lots of male folks where the challenge is coming from the testis itself. For post-testicular, the channel through which the testis, the duct, for one reason or the other, some as a result of exposure to sexually transmitted infections, you find the ducts where the sperm cells are meant to pass through are affected. While in the last case, sperm-related factors, you find the sperms of bad quality. Either the man is having low sperm count or is not even having a sperm cell at all. So in this case, we are looking at azoospermia, where the there are no sperm cells, then in the case of low sperm count, the count falls below the normal threshold, which should be well above 15 million and above. So when we see cases like this with the male folks, there is need for medical laboratory analysis, a lot of tests that has to be done at different sections of the hospital in order for us to know whether the causes are either pretesticular, testicular, post-testicular, or sperm related. Then another problem that can happen with the male folks is what we call varicocele. And this is where the valves within the veins are blocked for one reason or the other. So the testicular valves, when they are blocked, it can lead to a condition known as varicocele. And this can impair and make it difficult for the male to be able to achieve fertilization. So by and large, there's strong need for our males and our females to ensure they get proper tests done in order for them to know reasons for they not being able to achieve conception 1 year into marriage or more than 1 year into marriage. There's need for a history to be done. There's need for tests to be done. And once these tests are done, it will really go a long way. There are so many tests that can be carried out outside the routine medical examination. The medical personnel have lots of names for them. So I will want to bore all of us with those names. Yes, we know some of them like a stereoscopy, laparoscopy, colposcopy. Most of these tests has to be done. I don't want to tear your mouth, so so please just ensure that once you know you cannot achieve a conception after 1 year, the medical doctors know what to do. Now, naturally, we've seen cases where people do a lot to handle the case of infertility naturally. Yes, in time past, our forefathers were not having the bulk of this challenge. Why? Because they knew of natural herbs that handle infertility. They had that knowledge. And one of such plants is the one we refer to as the fertility plant. A lot of us do not know it as a fertility plant, but the elders do know it. They use it a lot during coronation. Yes, where like in Yoruba land, they call it akoko. It's a plant that, please forgive me if I'm not pronouncing it the right way, our Yoruba brothers and sisters. It is a fertility plant that most times it is used during chieftaincy coronation. That plant is highly respected by the traditional folks. Even in the eastern part of Nigeria, it is a well-respected plant. And the reason being that it is very good for fertility. We have so many other plants that are equally being used in Africa for fertility. So much so, and that's the reason why you find our fathers and our mothers, even at the age of 60, 70, they are still procreating. But today, our young men are finding it to procreate even at the age of 30-something. So it's really a shame. There's a lot our forefathers know or still know that we don't know. There's need for us to learn from them. Now, for some of us in the cities that cannot go back and learn from our forefathers, there's a wonderful company, the Superlife company. Superlife Nigeria is really doing a lot to bring this education to us. And there's a reason for that. The Superlife products are purely plant-based, and they are gotten from plant stem cell. And the technology that was used in getting it is referred to as plant stem cell technology. Why? Because the herbs you are refusing to meet your elders to get to help you with infertility are all harnessed into this product. Today, the product has been approved by NAFDAC, the certified agency in Nigeria that is invested with the responsibility of handling things like this. And we are so glad and excited to state clearly that the Superlife products like STC30, our SIC, the Super Road Coffee, and SNC are products that are available for people out there who are having the challenge of infertility. As a matter of fact, these products, for some of our male folks that have used the SRC, the testimonies are so many. The testimonies that are abound are so many. The SRC have been able to solve the issue of pre-testicular cause that we mentioned earlier, where there's a disconnect between the brain and the organ. In this case, this problem has been resolved, and our male folks are not having that challenge. It has even gone a step further in helping with testicular as well as post-testicular and spermal challenges. So most times, if you are using the SRC, you have to use it together with the STC30. And this product should be used between 12 to 24 weeks, once daily. Now, the beauty again is that for those who probably have their reproductive challenge as a result of infection, a combination of STC30 and SIC play a prominent role in helping. Yes, in helping. Why? Because infection is one major factor that is really hampering a lot of reproduction here in our own part of the world. Why? Because we're exposed to a lot of dangers. SIC is a very good product. Why? Because the stem cell technology infuses this product directly with your cells, making them to proliferate the cells that have been damaged. So if there's anything, take for instance, we are in the case of tubal blockage that we talked about earlier, a lot of it could be as a result of infection. So SIC combined with STC30 will do a yeoman's job in clearing that passage and making the tube very free for the egg cell to meet with the sperm cell. Now, for those with congenital defect, once it has been established, please, I want to reiterate here that you must not stop whatever advice the medical doctors have given to you. I am not using this platform to say stop what the medical doctors are telling us or telling you. No, you can use whatever advice or drug that has been given in line, hand in hand with this product. At some point, you can begin to reduce those other ones and continue with this. Believe you me, we've done this and we are getting the kind of results we never imagined possible. So I want to reiterate this fact while admonishing those who are listening in today's lecture that the Superlife products, if they were not credible, if they were not ascertained to do what they claimed they would do, it would not have been registered or recognized by our statutory body. And today, if you go to so many pharmaceutical shelves, you'll find this product abound. So I want to appreciate all those that have taken their time to listen to this lecture while encouraging you to, as a matter of fact, look into some of the manuals we have in this company that will help educate you and boost up your knowledge with respect to getting information on how to stay healthy, how to live a superlative life, the super life way, and live a joyful life. Once again, I want to say thank you and God bless you for listening. Thanks.